So, what's it like to be a physician right now in a time of such risk? Listen to this.
I am a surgeon, I'm a mother, I'm a wife, I'm a daughter, I'm a sister, and I absolutely expect to get sick. And I can only hope that I get a mild case of it, but I have no doubt that it will happen at some point. But, you always want to be one of the helpers, and in this kind of a job, that's my responsibility. But if I were to get really, really sick and things were to get bad, I would want my children to know that I have taken an oath to serve my community and to help my patients. And so even in this pandemic, I still uphold that oath. I don't think I've ever been more proud to be amongst this group, to be a physician. And we are all in this together.
And that is Dr. Niamey Wilson. She is the Director of Breast Surgery, Research, and Quality at Hartford Healthcare Cancer Institute. Thank you so much for joining us. I really appreciate you giving us the time. What is it like to be a physician in this critical time?
Thanks, Irene. It is very, very interesting being a physician during this time. I think probably the biggest difference between what we're all used to in medicine versus now is just how strange it is to have these kind of barriers between yourself and the patient. Most of us were trained in an era where it was very hands-on, lots of communication, hugs being given to our patients, things like that. And now, with the pandemic going on, we just don't have that kind of personal touch anymore, and it's just a very, very strange kind of environment now.
How have your patients been doing during this time? Are you using things like telehealth to get them through this time?
We are. We are using telehealth as much as we possibly can these days. We just don't want to take the risk of having somebody come into a medical facility if they don't absolutely have to. So Hartford Healthcare, I think the other day I heard that we've done over 2,000 visits per day at this point using telemedicine. And I actually see that probably being a part of how we do things going forward because it's been really wonderful.
And that's great that you have that kind of connection with them. But how are a lot of the patients doing during all of this? I know it's placed an enormous stress on the healthcare system, but how are the other patients doing?
Yeah, it's a great question. Our patients generally, they really understand why we're doing things the way that we are. But it's taken a little bit of a toll. So I can tell you, for example, what we're used to in the surgery world is having patients, families, friends, parents, whoever come with them for their surgical procedure. Now, because of the pandemic, the patient has to get dropped off at the front door. They're wheeled in, a nurse walks them to pre-op. They're never alone. We're always with them. But after their surgery, when they're done in the recovery room, the nurse then calls the family and the patient is then wheeled back out to the curb. So that's just been a strange experience for all of us. We're not used to it. We're trying to cope with it. Everyone understands why we're doing things like this, but it's definitely taken a little bit of a toll. But we're all just, working together.
Yeah, absolutely. We're all in this together. And you and your husband, you're both physicians. So what's it been like for your family life, for your children too?
Yeah. My husband and I are both physicians. So for us, every day we go to work. We leave the house. We go to our respective hospitals. So our kids, see us leaving. They understand why we do what we do. I have 3 kids, 4, 7, and 10, and they're used to it. They're used to us leaving the house and going to work. I have to say a huge thank you to all of the child care providers. Our nanny, Beth, she works for us knowing that she could get sick at any time because my husband and I are in the hospital. So, just a million thank yous to her and to all the people who are really helping the healthcare providers get to work.
Dr. Niamey Wilson, thank you so much for joining us and giving us your time during this critical time for the healthcare system. Please stay safe, and hopefully we'll see you again soon.
Thank you so much.